Hi there, my name is June. Today I'm going to show you a breakdown of the doctor's order, the MAR, transcribing a doctor's order to a MAR, the 10 rights and the 3 checks. We're going to go through all of that, and then we're going to put it together, and I'm going to actually show you a demonstration of what it looks like when you put all of that concept together and actually prepare and administer the medication to Jessie. So I'm going to start with speaking about hand hygiene and how important it is that before you're preparing and administering medications, or before you're doing any task really, that you're doing some really good hand hygiene. Always make sure your surfaces are clean when you're setting up to prepare medications. So first we're going to talk about the components of a doctor's order, and I'm going to bring your attention over to the overhead, and my cameraman is going to just show you that on the screen so you can see it. I'm just going to find my pen. And so I want to talk about, as the nurse, your responsibility to be accountable and ensure that your doctor's order has all of the components that it should have to be safe and accurate. At any time you are unsure or you're, of a doctor's order, or there's something missing from it, one of those components are missing that we're going to talk about, you need to get on the phone with the doctor and clarify what needs clarity. So we're going to start up here at the top of our doctor's order, and we're going to start with our patient's name. You just follow along with me. We're going to talk about all of the things that need to be on our doctor's order. Jessie's name, the patient name, is first. Then we have a health card number. Then we have a date of birth. If we move down, we can see the patient, any allergies they may have or concerns. There are many variations to how a sheet like this might look, but all of these components must be there. And so as we move down to the actual order, we can see a statement made by the doctor: give Ativan or lorazepam 1 milligram. PO means by mouth, once daily or orally, PO. So Ativan is our trade name, lorazepam is our generic term. And so let's just start seeing if those components are there. So we know we have we have a patient name, we have a health card and a date of birth. We know about allergies. We have a date and a time, so we can see clearly that this is most current. Then let's keep moving. We have the drug, that's another component. We have the dose. We have a route, so by mouth. And we have a frequency, once daily, and we have a doctor's signature. So I can see, looking at this, that I have all of the components of a safe and accurate doctor's order. Everything is here that I need. I am safe now to go ahead and transcribe this order to my MAR, or my medication administration record. So I'm going to keep my doctor's order handy. It's right beside me, and I'll repeat it as we're going along. But now I want to talk about all of the components of this MAR so that you can have a better understanding of it. And I'll try and zoom in a little bit on it. So now we're going to talk about transcription to the MAR, or the MAR already being transcribed. Sometimes it is already transcribed and sent up from the pharmacy for you, and sometimes we need to transcribe it ourselves if it's after hours or for different reasons. Transcription means that we are copying exactly what the doctor has said in his order to the MAR. It has to be exactly. You are never to change any component of the doctor's order unless you clarify with the doctor. You are going to transcribe or copy it exactly as the doctor has written it. You don't omit any words, and you don't add any words. So if we go back to the MAR, we'll talk about how it all moves from the doctor's order to our MAR. So we start up at the top, always be very systematic, and we can see that our patient name is Jessie Moore. We have a date of birth, and we have our allergies, which there are none. We look across, we can see the month, and we can see the year, so we'll go ahead and put in our current month. We have our year. And if you look across the top, you can see that it's running in different ways. So it's running horizontal for the date, and it's running vertical for the time. It's important to understand how a MAR works so that you know what you're signing. And I'm going to go through this step by step with you. We're going to start transcribing the doctor's orders. So the first part of our order, I'm just going to quickly put that for you to see again. It says give Ativan or lorazepam 1 milligram by mouth once daily. Okay, and we can see the date. So if I go back to my mark here, date ordered is May 15th. So I'm going to write in May 15th, 2020. The stop date, there is no stop date, so I don't need to put anything there. Let's move on to the next part. It says drug and dose. The drug is Ativan. That's my trade. The generic is lorazepam. The dose is 1 milligram. The route is PO. And the frequency is once daily. And we write out a lot of our orders more today than we used to many years ago because of medication errors. We try not to use abbreviated terms unless they are accepted by the societies that develop these abbreviations. So we have our date ordered, we have our drug and our dose, we have our route, we have our frequency, we know we had the doctor's signature, we checked at that. And so now part of transcription for a nurse is that always a second nurse checks that work. So I'm going to put my date here first. So I'm putting day, month, year. It's the 15th day of the 5th month of 2020. And I'm going to put my initials here and a slash. So when a second nurse comes and checks this doctor's order against what I have written here, that nurse can then come down here to the bottom. If you just follow down with me, I'm going to show you all the way down here. This is the next important part of a MAR. It's the master signature part. So I'm going to start by putting my signature and my designation and my initial. And that's important for a couple of reasons. It identifies whose initial this is. So who was the initial person who transcribed this doctor's order, right here. And the next nurse that comes along and checks my work, so the next nurse is going to take this doctor's order, look at everything that's there, and make sure and confirm that I have copied it correctly and accurately to the MAR. That nurse is going to initial right here and sign right down here at the bottom. Their master signature, designation, and their initial. The next reason that that initial is important in the master signature is that after I actually have given that medication to Jessie, I'm going to need to sign that I've given it with my initial. So if I put today's date here, because we're going to actually give that medication in a few minutes, I'm putting again day, month, year. That's how you write dates. And the time is going to be 1000 hours. Because it's once daily, I can use that whole block. I don't need to make space for other times in the day. After I've actually given that medication, I'm going to make a little perforated line here just so you can see that that's where my initial would go. And I'm going to show you that at the end. We'll go back to that. Okay? You can see there's other spots, so you can add more than one drug to a medication administration record. Some MARs are set up for 7 days, 3 days. Some are actually run in long-term care for the whole 30 days. It just depends on the agency that you're working at. And this is just one example of what a MAR might look like. So once the second nurse has checked that MAR, and she signed her initial and a master signature, and I've checked all that, I don't need to look at the doctor's order anymore. I can put that doctor's order away in the patient's chart, and I can just work on using the MAR to actually go and prepare my medication. So I'm going to leave that, actually I'm going to bring it over to my med cart now, and I'm just going to shut that off for now. I'm going to bring my MAR over to my med cart, where I'm going to be preparing my med. And so now I want to talk about the rights and the checks that go along with our preparation and administration of medications. So there are 10 rights and there are 3 checks. The 3 checks happen throughout that preparation of the medication. The first check happens whenever we encounter that medication. So if, for example, this med card has little slots in the front, it has a bunch of slots in the back, and they have all different patient names. Over here on this side, I have a drawer that has Jessie Moore written on it. And I can confirm that name with my MAR. So I'm very close and personal with my MAR. I keep it very close to me when I'm preparing medications, and I'm very focused. I'm not talking with other people. It should be an area where you're completely focused only on that patient, only on that one drug. You're not doing anything else at that time. And so that's my first encounter with the medication. So, for example, I would pick up that drug, and that would be my first check. And we're going to go into detail about that in a second. So there's 10 rights and 3 checks. That first check is when I first encounter the medication. I apply those 10 rights to that first check. As I'm preparing that medication, I'm going to do my second check as I'm about to tear it open or take the top off of the vial. Whatever type of a medication you are getting ready to prepare, your second check occurs somewhere in there. I'm going to apply those 10 rights again. Some of them don't all apply at each check, but you're speaking to that they're going to be coming, that you're aware they exist. And then the third check happens before you're ready to discard the vial or the packaging, the paper, the blister pack, the bottle, wherever it came from. That's your third check, and you're applying those 10 rights again. So let's talk about those 10 rights for a second. The first right is right drug. Do I have the right drug? You're checking against your MAR. You're making sure that the label on the medication, this is a unit dose, for example, we're going to be looking at today. It's going to have the drug name, the generic, the trade, maybe. It's going to have the dose. It's going to have an expiry date. We're always checking for expiry dates as well on our medication. So that's our first right. Do I have the right drug? Right dose. We just talked about that. Is the right dose in that package or that bottle, whatever is there, or do we need to manipulate that pill if it's a PO med? Do we need to split that pill in order to get the right dose? So do I have the right dose now, or will I have the right dose when I'm preparing it? Right time. Is this the right time for the patient to have this medication? We have a 30-minute window, as you know from your pharmacology course, on either side of the time. So this drug is going to be given at 1000 hours or has been ordered at 1000 hours. If it was 9:30 or 10:30, it would be perfectly acceptable to give this medication because of that 30-minute window. Right route. The doctor has ordered PO. Is this a PO drug? Is it appropriate? Is the patient able to swallow? All of those things you're thinking about and assessing when you're going through those rights. The next right is right patient. So important. So I'm going to just move over here for a second as I begin to talk about some of these next rights, because it's important for me to go in and identify that I have the right patient. But there's also some other important things that I need to talk about. I need to educate myself about that drug, for example, before I've ever given it. So I may pick up my Davis Drug Guide, look up Ativan / lorazepam, that's our generic term, find out all of the implications, contraindications, what it's used for. I need to be educated on that drug before I ever come in and identify myself to the patient and perform some hand hygiene and identify myself and say, "Hi there, Jessie, my name is June and I'm going to be your nurse today. The doctor's ordered Ativan for you. Are you familiar with that drug?" But before I do that, I'm going to first identify my patient properly and ask him to tell me his full name and date of birth, and he's going to tell me, and I'm going to compare that to the name band. So important, so core to our practice to make sure we have the right patient. And when that's all safe and okay, I'm going to explain what the doctor has ordered. I'm going to educate Jessie so that Jessie can then give me consent. So I've just covered the right education and the right reason and the patient's right to education and the patient's then right to refuse, because Jessie does have the right to refuse this medication. And if he does, then I can ask why and talk to Jessie about it and document it and call the doctor if I can't resolve it and ease Jessie's worries. So I know I'm going in depth with some of these things, but it's really important for you to be very present in those 10 rights and how they roll out for you in your mind as you're preparing your medication. It's no good to memorize these rights. You have to understand what they mean. So I'm just going to come back over here now. So I've covered right drug, right dose, right time, right route, right patient. I know the right reason because I've looked in my Davis Drug Guide, and we're actually going to go through that together as well. I'm going to show you how to use the Davis Drug Guide. We've talked about the right education and the right to refuse. So that leaves two, and that is the right evaluation and the right documentation. And so documentation, kind of ongoing, but at the end, after I've watched Jesse swallow that medication, I know he swallowed it, I can come back to my MAR, I can safely document and sign my initial in that spot that I've talked to you guys about. And then the right evaluation is ongoing, and of course after I've given the medication. Because when I look up my drug, for example, in the Davis Drug Guide, I'm going to look at the onset and peak and duration. So I want to know if I'm giving Ativan, which is an anti-anxiety medication, I want to go in as well as identifying and educating my patient. I want to get a baseline of how Jesse is feeling. I want to see if Jesse is anxious. Talk to him, get a good baseline so that I can document if there's been an improvement after the initial onset of that drug has taken effect in his body. So those are those 10 rights, and we talked about those 3 checks, and we'll do it again as I go through the actual demonstration. So now let's talk about the Davis Drug Guide. So the Davis Drug Guide is a great book. It becomes your best friend. As a nurse, you always have the right to stop and take a second to process the medication, make sure that you know everything you can about the drug, especially when it's new to you. So the Davis Drug Guide is very simple to use. You can see that throughout it has a lot of little, you can see the line where you can kind of quickly go to the alphabet letter that drug might be in. I'm going to show you how to use it most efficiently because you can spend a lot of time or waste a lot of time looking for a drug if you're unfamiliar with both its trade name and generic name. At the back of every drug guide, there is a comprehensive index, and it means that it has both the trade name and the generic name. So if I wanted to look under Ativan, I could go right to the A section. And I'm going to do that quickly just so you can see how efficient it is. And I'm going to find it under A, Ativan, and it's on page 791, 1353 to 1354. If I wanted to then go to L, because its generic name is lorazepam, so I think that page number, you remember that, it was page 791. So if I go to L, quick, under lorazepam, it actually tells me 791 again. So then I'm going to go to page 791, and there it is. Okay, and I'm just going to get the camera to kind of zoom in for a second, and I just want to show you what that looks like for you. You can see how it has sections. It's very well laid out. I'm going to turn the page here and you can see the other sections, nursing implications. We're going to talk about those for a second. Okay? So when I go to my Davis Drug Guide, I can start by looking at the drug name. I can see how it's pronounced. I can see its trade name below. I can see its classification. So it's an anesthetic adjunct. It's an anti-anxiety agent. It's a sedative, a hypnotic, and it falls under the pharmacologic of benzodiazepine. And so you'll hear of all different types of PAMs, drugs that end with the name PAM. It's indicated for anxiety disorders. It can be given IM, IV. It's a pre-anesthetic. Its action is that it depresses the CNS. There's so much information in here, and you are absolutely accountable and responsible to do that as the nurse. You can see its half-life. You can see the route. So PO, the onset is 15 to 60 minutes. So somewhere between 15 minutes and an hour, we're going to see the effects in our patient after we've given it by mouth. I can also see the onset, peak, and duration for IM and IV as well. Then I can look at contraindications and precautions. Those are very important for the nurse to understand. Any reasons that Jessie might not handle this medication well, so important for you to know. Any adverse reactions or side effects. The maximum dosages for adults and for pediatrics, and then of course our availability, how it's packaged or how it comes, and because it does come in injectable, it does come in sublingual, it does come in a PO. And then we have our nursing implications. So in our assessment, we would know what to look for that might be important, some potential nursing diagnosis, and then implementation. So your Davis Drug Guide is very important, and I encourage you to always, 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 until you're very familiar with a drug, to always check what you're doing. So that's our medication administration and preparation kind of taken apart. Now I'm going to put it together for you and show you what that looks like. Okay. So I have my transcribed MAR and I'm ready to go. I'm going to begin with hand hygiene. I have my MAR with me wherever I am preparing that med, whether it's in a med room, an Omnicell room, a med cart such as this today. I'm going to make sure my surface is clean and that my hands are clean. When you're preparing PO meds, there are times that you will need to apply clean gloves in order to work with that medication. Perhaps you have to split it in a splitter machine, and you'll need to put on gloves for those types of things. Otherwise, we try to not touch that medication with our hands if at all possible. It's all just a good aseptic technique. So I'm checking my MAR. I'm going to prepare and administer my medication now. I'm going to look at my MAR and see that I need Ativan 1 milligram. So I'm identifying Jessie Moore on my MAR. So important that you're always looking at your MAR. I'm looking down at the drawer and I see Jessie Moore on the tag of the drawer. I'm confirming always that I have the right patient. So I'm already starting to roll through those rights as I do my first check. I have the right patient, I have the right drug. Ativan, that's what's written on my MAR. Ativan, that's what's written on my unit dose of medication. The expiry date is good. And the dose is actually good. I don't need to change or manipulate this medication at all. It's 1 milligram. And I'm confirming on my MAR that I have 1 milligram. So I have right patient, I have right drug, I have right dose. It's a PO med. It's to be swallowed by mouth. It's not a sublingual. That would dissolve under his tongue, so he can swallow this medication. So the route is correct. It's PO. The frequency is once daily. The right time is okay. It's just a few minutes after 10, so we're still in the window. It's been signed by 2 nurses, so I'm always checking my MAR. I know that the right reason. My patient is feeling some anxiety and the doctor has ordered Ativan. It's an anti-anxiety medication. I've gone in and identified my patient. I know that Jessie does have some anxiety, so I know the right reason. I've given Jessie the right education, and so therefore he was able to give me the right to refuse, which he didn't. He consented to having this medication. And documentation and evaluation will happen as I'm completing my task. So that's my first check. So now I'm happy with that. I'm going to get my med cup and I'm going to begin preparing it. So for this PO, it's pretty straightforward. I'm going to just tear down my little unit dose close to where the tablet is. You can see that a little bit through the camera. And that'll just slip into the cup without me ever having to touch it. While I have that package in my hand, I'm going to go ahead and I'm going to do my second check. And so I know it's redundant, but this is where we catch medication errors. It's by the second and third checks that we're catching them. I'm going through all of my 10 rights again. Right drug, right dose. I'm checking it against my MAR. You have to be very present and just continue to be very present in those checks. It's very important. Right drug, right dose. I've given Jessie the right education, the right to refuse. The documentation and the evaluation are kind of ongoing and happen at the end. I know the right reason. So that's my second check, and so now I'm ready to do my third and final check before I discard of this packaging. And so I'm going to start right at the top again. Do I have the right patient and the right drug and the right dose? And I'm comparing it all to my MAR. Every time I'm not just saying it out loud. You cannot memorize the rights. You have to understand what you're doing. That's how you protect your patient. And so I've identified my patient. I know I have the right reason and the right education. I've given Jessie the right to refuse. Everything is solid there. That's my third and final check. I can know that I have very safely prepared this medication. And so now I can discard that in the garbage. And I have my MAR and I have my medication. And I'm actually ready now to go into the patient's room, and I'm going to do my final ID of my patient, talk to Jessie again in case he's forgotten that I was there a few minutes ago. And so let's go to Jessie's room now with my medication and my MAR. Very important that they travel together. So I'm going to enter the room. I'm going to do some hand hygiene in front of my patient. I'm going to identify myself. Hi there, Jessie. My name is June. We spoke a few minutes ago. Can you please tell me your full name and your date of birth once more? Thank you very much. And I'm just going to compare that to your bracelet, and I can confirm that my MAR says Jessie Moore, and this bracelet says Jessie Moore, and Jessie says I'm Jessie Moore. And date of birth. At least 2 patient identifiers. Name and date of birth, or name and health card number. And so I'm just going to reiterate. Hi, Jessie, I'm back. I have your Ativan. How are you feeling now? Do you have any questions? Is there anything that I can do for you right now? And would it be okay if I give you this medication now? And so Jessie's going to consent, and I'm going to either hand it to Jessie or I'm going to give it to Jessie depending on what Jessie needs. I'm going to pour some water for Jessie and tell him to swallow it, not to chew it. This is not a sublingual medication. I'm going to explain that it's going to take about 15 minutes to an hour for this to start working, and that I'm going to come back and check on him frequently to see how he's doing, and I'm going to make sure the call bell is handy and that Jessie can reach the call bell and call me if he needs me. And then and only then, when I am certain that Jessie has swallowed that medication, I may even check if I am suspicious at all that Jessie didn't swallow it, and then and only then am I going to take out my MAR for the final time that I've confirmed and everything is safe. I've given that medication. Now I'm going to sign my initial directly across from where I gave the med at 10 o'clock. So it's very important that you continue to evaluate and assess your patient throughout that hour. Document, call the doctor. If there are any issues, anything that is adverse, that didn't go the way that it should for Jessie. Of course, our goal with Ativan and anti-anxiety medication in this example is that it should help Jessie to relax and not feel quite so anxious. So if that didn't happen, we need to speak to the doctor about that. Make sure you document anything at all that needs to be documented. And that concludes our demonstration of safe preparation and administration of a medication using a PO med and the components of a doctor's order and transcribing a MAR. Thank you.